Welcome, everyone, to another episode of Susan Lopresti Wellness, Mind, Body, and Soul. This is the podcast where we explore the highs, the lows, and everything in between when it comes to a woman's life, her health, and all aspects of navigating the midlife landscape. I'm your host, Susan Lopresti, and I have a very special guest with me today. I'm super excited to introduce you to Dr. Polly Watson. And I'm going to give you her full bio because I think her work is incredible and it's totally what I believe in. And it's the reason why I started my podcast. So I will tell you that Dr. Watson is a board certified OB-GYN with over 20 years of experience specializing in menopausal, sexual, and functional medicine. She is an expert in addressing a wide range of hormonal concerns, including PCOS, PMS, perimenopause, menopause, low libido, and sexual pain. As a certified practitioner with the Institute for Functional Medicine, Dr. Watson integrates holistic care approaches that go beyond traditional medicine. She specializes in menopausal medicine through the Menopause Society and sexual medicine through the International Society for the Study of Women's Sexual Health. Dr. Watson partners closely with her patients, utilizing a combination of lifestyle modifications, nutrition, mindfulness, bioidentical hormones, and supplements to optimize hormonal balance, and overall well being. Her journey in medicine has evolved in ways that she never anticipated when she began over 20 years ago. Early on, a career in women's health felt inevitable to her. Growing up in Atlanta and attending the Padina School, she was deeply interested in women's issues and biology. In college, she pursued a major in molecular biology and biochemistry, while also taking several women's studies courses. By the time she reached medical school, OB-GYN quickly became her favorite rotation, setting the stage for her residency and early career in obstetrics and gynecology. After 3 years in practice, she became a parent, which prompted her to reevaluate her path. With her son's arrival, she began gravitating towards office gynecology and menopausal medicine. She noticed that the OB-GYN field often prioritized childbirth and surgery, leaving menopausal women underserved. This realization led her to further specialize by studying menopausal medicine through the North American Menopause Society and sexual health through the International Society for the Study of Women's Sexual Health. Even with this advanced training, she encountered patients with concerns outside of the traditional medical curriculum, questions about supplements and adrenal health and environmental toxins. Their curiosity inspired her to dig deeper, and she soon began exploring integrative medicine. Her first conference in the field was transformative. For the first time, she was part of a conversation focused on chronic health issues that conventional medicine struggled to address. This shift had an immediate impact on her own life. After implementing dietary changes at home, her son's academic performance skyrocketed, reinforcing for her the concept that food truly is medicine. Despite these breakthroughs, she found herself increasingly frustrated by the constraints of insurance driven medicine, which felt more like ticking boxes than truly healing patients. She discovered functional medicine, a practice that reignited her passion for learning and patient care. Unlike the burnout that she saw in traditional settings, these physicians were optimistic, energized, and changing lives. After exploring various integrative and holistic medicinal approaches, she found her home with the Institute of Functional Medicine. Over 2 years of study, she earned her certification in 2019, becoming one of approximately 1,000 certified providers in the US. That same year, she left her role as an employed physician and launched Hormone Wellness MD. What started as a practice in one single room has grown into a thriving team of 5. And together, they support over 1,000 individuals on their health journey. Her practice is grounded in the belief that wellness is holistic and personal, and she's so grateful to work in a field that allows her to help people transform their health and their lives. So, without further ado, Dr. Watson, thank you so much for coming on to my podcast. I so appreciate the work that you are doing.
Well, thanks so much for having me. And I appreciate the work you're doing, because midlife can be a fantastic, transformative time. And I love dwelling on the positive.
Absolutely, absolutely. And the reason why I am so passionate about functional medicine is my own personal experience. And I'm just going to give it to you real quick. When I was going through menopause and having unbelievable issues that were coming out of nowhere, I was seeing conventional doctors, and they were telling me that it was perfectly normal for a woman my age to feel the way I did. And I just could not accept that as a diagnosis, because I saw my mom go through menopause and she didn't have half the issues that I did. And when I
Right.
finally went to see a functional medicine doctor, because I didn't know where else to turn at that point, she completely transformed my whole entire life. She diagnosed me with celiac disease, which no one even thought to look at.
Right.
Hashimoto's thyroiditis is another thing that no one checked for me. And just by changing my lifestyle, my diet, going on some supplements, completely transformed my life. So that's why I'm so passionate about having you on today. I'm super excited. And I want to start with one topic first, and that is because I hear a lot about it, PCOS with women, and that was one thing that I didn't have. So can you get into what that's all about?
Sure. So polycystic ovaries syndrome is PCOS. Some people call it PCOS. I always sort of grew up with PCOS. I have PCOS. It is pretty common. About 5 to 8% of the population has it. And when I finished medical school 20 years ago, we were talking about it a little bit differently than we're talking about it now. And so what we were trained 20 years ago was something called the Rodenberg criteria, which basically meant that when you see someone with PCOS, typically they're having irregular cycles or no cycles. This is usually a condition that is seen in reproductive age women. So premenopausal women, usually this would be something that someone's going to present with maybe a family history. And maybe they're going to present with, we all have irregular cycles when we're 12, 13, 14. If someone's 15, 16, 17, and their cycles are still irregular, they may have clinical or laboratory evidence of too much testosterone. So sometimes that's unwanted hair growth. So that could be facial hair, that could be kind of like a pubic hair pattern, should be like a triangle facing down. If the pubic hair pattern sort of looks like a diamond, where you also have a triangle going up on the abdomen, that's a kind of more male pattern, hair pattern. And so then we get concerned about a little bit of testosterone excess. So what happens in PCOS is the ovaries aren't ovulating normally. They're producing excess testosterone, and that causes a lot of metabolic problems like insulin resistance. So many women with PCOS are going to have more of an apple body type, it's usually struggling with obesity, that kind of thing. My doctors, I was not struggling with obesity or a lot of hair growth. I'm a pretty petite person. And so I would walk in with my irregular cycles and my really bad acne. And I'm like, I think I have PCOS. I'm like, you're not fat and hairy. You don't have that. And so we've really expanded our understanding of PCOS now to know that it can affect lots of different body types. And now we're also really addressing kind of the adrenal component of PCOS. So if you think about someone who's chronically under a lot of stress, if their adrenal glands that make DHEA and cortisol are overstimulated, that's going to make excess DHEA, which is going to turn into estrogen and into testosterone. So you're still going to look like that hyper estrogen dominant, too much testosterone pattern. So that could come from the adrenals or it could come from the ovaries. So now our more modern concept of this is addressing both, at least in functional medicine, is addressing both adrenal health, metabolic health, ovarian health, and kind of putting all of that together. But it's really important, even if women in midlife may or may not have gotten diagnosed with PCOS, it's really important if you've had this diagnosis or you suspect the diagnosis is appropriate to communicate about it. Because a lot of the problems with PCOS, estrogen dominance, insulin resistance, what does that look like? That looks like perimenopause, right? Yes. When your brain is yelling at your ovaries, hey girls, work harder, we can try to have one more baby. A lot of women are having heavy irregular cycles. They're estrogen dominant. They're not ovulating enough. They don't make enough progesterone. So they have mood issues, sleep issues. A lot of women in perimenopause are getting a little bit of a stash, right? A little bit of unwanted hair growth. So there are some overlaps there that I think make that conversation about PCOS really relevant to a midlife audience. And then I think the other thing is if someone does have a diagnosis of PCOS, they have an increased risk later in life to develop cardiovascular disease and to develop diabetes. So all of the things we would do for great metabolic health, having fantastic exercise with a lot of resistance work and weightlifting and maybe sprint interval training, maybe some carbohydrate restriction, being really intentional about a whole foods diet, not eating a lot of processed food, not eating a lot of refined carbs. All of those things are going to be important for both populations, the perimenopausal population and the PCOS population. So I think there's a lot of overlap when we're kind of talking about hormonal health, no matter what age you're at.
So it's just lifestyle changes or diet changes, or is there medication involved as well?
So in the conventional space, typically we were taught to turn off the ovaries. The ovaries aren't working correctly. We were taught to suppress the ovaries with oral birth control pills, okay, and then correct the insulin resistance with medication like metformin. Mm-hmm. In the more functional medicine space, we would be thinking about insulin sensitizing supplements like berberine can be as effective as metformin. We may be using something called inositol, which is a B vitamin derivative that can help with insulin sensitivity. It can also help with balancing that metabolic disruption. Sometimes we're using things like saw palmetto, stinging nettle, pygeum to help block the testosterone. In the conventional space, we may be using something like spironolactone to block the testosterone. So we can draw from different sources, either allopathic sources or more holistic functional sources, just to kind of meet someone's goals and what their resources are, what resonates with them. I'm kind of a both and girl, not an either or girl.
Okay, I was just going to ask you, what do you lean towards with that? If you strictly just providing like functional,
yeah,
holistic.
I really try to partner with my patients. Yeah. And sometimes cost is an issue for people because a lot of times when you're paying for all these supplements out of pocket, that can be a financial burden. Whereas if you're writing a prescription, sometimes those can get covered. Yes. I would say a big caution for everyone, if you have a prescription for spironolactone, that can cause urogenital symptoms. And so spironolactone is an old-fashioned blood pressure medicine that we use a lot in female pattern balding, kind of testosterone-driven hair loss in women. That can also happen either with PCOS women or with midlife women, right? It's used sometimes for acne. It's used sometimes for unwanted facial hair. The problem, and I think the thing that we're not bringing to the forefront, is sexual wellness with women. So you have both estrogen and androgen or testosterone receptors on your urogenital tissues. If you block your testosterone receptor with spironolactone, you can develop something called a vulvar vestibulitis. Itis, it's inflamed, it hurts, right? So your vestibule, the sort of opening to your vagina, is bright cherry red and hurts to touch with a Q-tip. I mean, these women are miserable. But I think sometimes maybe the dermatologist that prescribed the spironolactone for the hair loss on their head maybe didn't have training in gynecology or sexual medicine and didn't know to tell the patient that that could be a side effect. So I think that's another maybe reason to kind of, I like the stinging nettle pygeum and some of these more gentle things
Yes.
because they don't have that side effect.
Right.
But I like to partner with my patients, educate them. We are making decisions together based on their budget, based on what their goals are. We can draw from both pools. We just need to make sure we understand side effects from each.
Right. Right. So, what are some of the obvious symptoms of menopause?
Okay. So I'm really glad you asked this because I feel like there are a whole lot more that are coming up, right?
Okay.
And what I mean by that is when we, again, went to school 20 years ago, we were sort of thinking about menopause in terms of hot flashes, night sweats, vaginal dryness, or sexual pain. We also thought about bone loss, right? We know that
Yes.
menopause is a really significant time of rapid bone loss. And so when hormone replacement therapy was FDA approved, that's all it was FDA approved for, okay? And now we know there was a paper, maybe 2023, called the musculoskeletal syndrome of menopause. It's a great read. It's open source, so you don't have to get behind a paywall to access it. A lot of women are having both significant muscle loss, but also a lot of muscle pain, joint stiffness. We see a lot of frozen shoulder, a lot of fibrosis in joints. So some women come to me and their first complaint is not hot flashes and night sweats, but joint pain or muscle pain. I think we
I
need to be
got it.
talking about that more, right?
Yes.
We certainly see, and there's a lot of research on this like that right now, and I think we're still learning about it, but we see some changes in working memory, particularly in the perimenopausal time when estrogen levels are rapidly fluctuating. That can definitely affect our mood, things like word finding, and kind of a short-term working memory. And there is some literature that suggests that if we replace estrogen during the perimenopause, so you're still having some irregular periods, you're not in menopause yet, you're not where you have had no period, that can help that time. And so I think it's also really important to kind of get rid of this idea that you have to be, I have not had a period for a whole year before anyone can give me hormone replacement therapy. That's just not true. Okay. And we know that the bone loss from low estrogen starts in the perimenopausal period. So I'm not waiting for my patients to get to be that I am officially postmenopausal. It's been a year since my last period before I help them. They could be in this perimenopause for 2 to 10 years.
Mm-hmm.
So it is not fair, reasonable, or just to expect women to suffer for that long, right?
Right. Absolutely.
So, sleep disruption, we see a fair amount of sleep disruption that may be independent of hot flashes and night sweats. A lot of women will complain of that early morning awakening between 2 and 4, where they're having that big cortisol surge. We do see some hair changes. So, some women will report some hair thinning. I think that a lot of these things, Susan, are so hard to tease out. And what I mean by that is that midlife women are managing elderly parents. And sometimes
Yes.
that is an enormous caregiving challenge. A lot of us are launching children, adolescent, young adult children into a world that is extraordinarily different than we were at that stage. And many of us have the career ceiling right over our head, right?
Yes.
So it's sort of like that scene in Star Wars where Leia and Han Solo are in the garbage compactor and all the walls are closing in. That's kind of what perimenopause and menopause feels like. So if my hair is falling out, could that be because of the life stressors that I'm in? Is it necessarily hormonal? Is it because I may have had COVID or the flu and it's telogen effluvium and my body got really hit hard from that virus? So I think it's also kind of sometimes tricky to tease out,
Yeah.
is this hormonal or is this the fact that there's a lot going on in life right now?
Yeah, for sure. I think it's a combination of
Mhm.
everything. You put it together because midlife is one of the most trying and difficult to navigate, I think, anyway, in talking to a lot of women. But once you get past that, when you're in menopause and beyond, it gets easier again, I think.
Well, I feel like we didn't talk about sexual health. So let's talk
Right.
about that really quickly. So many women will experience vaginal dryness and sexual pain, and it doesn't have to be penis and vagina sex. I think we want to be inclusive about any kind of sexual activity that people want to have. The urogenital area, we may experience more urinary frequency because the anterior vaginal wall where our urethra is running is getting thinner. Okay. We may have, if we have any penetrative intercourse, we may notice little microscopic tears in our vagina. So some women will complain of burning and stinging after sex because the tissue didn't stretch, it tore. And then we may notice this difference in sexual functioning. Orgasm may take longer and may feel like a squeak instead of a big roar. And so I cannot say this emphatically enough. This is not a lubricant problem. This needs hormones. Hyaluronic acid is great, and there are some studies that shows that hyaluronic acid is effective. However, estrogen or vaginal DHEA is extraordinarily safe, and I think so many women are afraid to get their sexual pain treated because they read the back of the package insert and it basically reads like a death warrant, right? I mean, and so vaginal hormones do not have significant systemic absorption. They're ACOG, American College of Obstetrics and Gynecology. Even if you were a breast cancer survivor, there are position statements that we can give low dose vaginal hormones to breast cancer survivors. So please don't let fear get in the way of having the pleasure you deserve, because I think midlife is this tipping point, right? It's the time where my health is really letting me know I have to start taking some time and energy for myself. I have to
Mhm.
start taking up some space in my life. My exercise needs attention. My diet needs attention. My sleep needs attention. I'm going to be really intentional about who I'm spending time with. If people are energy vampires, we
You're
gotta
gone.
we gotta garden and bird and go to yoga and do all those things. And so I think it's this really pivotal time. It's sort of like this second adolescence. So if we can be like, you know what, these are my people, I'm going to be intentional, I'm going to create my community here, I'm really going to dive into this. I think we can have such a stronger second half of our life. But
Yes.
this is the wake up call. And if we don't listen to these signals and we just say, kind of like your doctor told you, well, this is normal for women your age. Well, it may be normal, but it's not acceptable,
Right.
right? I am not going to just sign up to being like, I'm going to feel like crap because I'm older, right? We're going to live to be 80, 90, 100. We're keeping people alive a long time.
Yes.
So let's live well. Let's create health span, right? So,
I love
and don't
that.
you think after you turn 50, you just don't care so much what other people think
Right. You
anymore?
don't care. You become very self-absorbed in a way. It's all about you. And it should be, because your whole life it was always about your husband, your children, everything else, your boss. And now all of a sudden you have this freedom. Like, oh yeah, I could say what I want. I could feel what I want. I wanted to ask you, so bioidentical hormones, because I was put on them when I was going through perimenopause and I went to a functional medicine doctor, and it was life changing to me. But I think there's a misconception that people feel that they're dangerous or they cause cancer. And wasn't that the other types of hormones that were back in the 70s and 80s? So can you touch
Yeah.
on
So
that?
this is a really good topic, and I think there's a lot of confusion around it. So, bioidentical means that it's a chemical copy of a hormone that exists in a female human being's body. Okay. you can get a bioidentical hormone at the regular pharmacy. So not all hormones that you buy at CVS are necessarily unhealthy. Okay. So the Women's Health Initiative study, which may be the big study that a lot of people got afraid about hormones, it was published in the early 2000s, and it was on pregnant horse urine estrogen or conjugated equine estrogen or Premarin, and combined with a synthetic progestogen. So it wasn't progesterone. Progesterone is bioidentical. A progestogen is a chemical that sits in a progesterone receptor but isn't progesterone. Okay. So in that study, the one that they used was medroxyprogesterone acetate. Okay. So, quick thing, if you have a uterus and we give you estrogen unopposed without a progesterone or a progestogen, we can give you uterine lining cancer, because estrogen is the growth signal. Hey, there's a baby coming. Let's make a nest for the baby to live in. Okay. So, in the estrogen only arm of the WHI, even though they were on pregnant horse pee urine estrogen that was oral, we would never do that anymore, right?
Mhm.
That arm of the study did not have any bump in breast cancer at all, zero. Okay. Nurses Health study, same thing. Estrogen alone, again and again and again, even different kinds of estrogen, estradiol, which would be bioidentical, same thing. We don't see a bump in breast cancer. We saw the bump in breast cancer when we added the synthetic progestogen, and that bump was 3 women out of 1,000 over 5 years.
Oh.
So when you really listen to the numbers, that's about the same cancer risk increase of having a glass and a half of wine a night,
Uh-huh.
which I would really encourage people to moderate their alcohol intake, because alcohol causes a lot of cancer. European studies, which I think is what you're alluding to, for 30 plus years now, have shown us that micronized progesterone, which you can get as a FDA approved drug, either from the regular pharmacy or you can have it compounded, didn't seem to bump up breast cancer over that of postmenopausal controls. So we are dumping poison in our environment faster than I could say, right? There are a lot of things that could cause cancer, but it didn't bump up someone's risk over their baseline risk. Does that
Mhm.
make sense?
Yes.
So when we're thinking about hormone safety, cancer risk, we want to use a micronized bioidentical progesterone. And then the other thing we think about is cardiovascular disease, right? If you give
Yes.
someone oral estrogen that goes through their liver is where you make clotting factors. We're going to increase the risk of stroke and heart attack. We can avoid that risk by using estrogen through the skin. So either a patch, a gel, or a cream. So we bypass first pass liver metabolism and we get around that risk. So bioidentical just means a chemical copy of the hormones your body would make naturally. And you can get some of those with intention at a regular pharmacy, or you can have them compounded. I would say that the bioidentical progesterone that we can get from the regular pharmacy does have some food dye in it. So if people are sensitive to that, or if they're sensitive to peanut oil, it's suspended in peanut oil, then we can use compounding certainly in those senses, because we can avoid that sensitivity. The other kind of tricky thing about progesterone is that with what people's insurance will cover from the regular pharmacy, I don't have a lot of choices. I have 100
Yes.
milligrams or 200 milligrams. And if I need to dose between that, that's where the compounding pharmacist can be really helpful.
Yes. Yeah. But they're certainly very, very helpful. I know they were for me when I was going through
Oh,
perimenopause.
absolutely.
Yeah.
Yeah. I'm 51. I've been on hormones since I was 40,
Yeah.
and it is a game changer. And we didn't talk about testosterone. Should we talk about
If you
testosterone?
want, sure, go ahead.
So I think that there was a paper called the Global Consensus Statement on the Use of Testosterone in Women, and it's kind of old now. I want to say it's 2017, 2018, something like that. And in that paper, they said that all we really have at this point, data to support, is that replacing testosterone to physiologic levels for cisgendered women. So, no disrespect to our transgendered friends, but if we're working within a cisgendered population to the sort of the what their body would normally make during their lifetime, and we
Mm-hmm.
replace that physiologic dose, that we can increase a sexually satisfying episode about one more time a month. And so for some women, testosterone can really help with libido, sexual functioning, sexual interest. What I wish we had more really clear data on, but my clinical experience, so this is my experience, not something I have evidence to back up, is that testosterone helps a lot with muscle recovery. So I'm trying to get everybody to go to the gym and lift heavy, right?
Yeah.
We want to stay strong. We don't want to break bones. We want to take care of our hearts and our brains. We want to lift heavy weights and get comfortable with that. And estrogen helps us repair muscles. So we're going to replace that. But testosterone also really helps that. So I see in my women that are lifting, testosterone really help with their muscle recovery. I think when people are getting these really high dose pellets and they're like, yeah, you're going to get ripped. You got to lift weights and eat protein and work hard to build muscle. Building muscle is no joke. A testosterone pellet isn't going to do it for you. You've got to put in the work. But I do think supplementing a physiologic dose of testosterone can be helpful. It does have some side effects. There's about 11 to 13% chance of getting acne. Usually it's kind of periorbital acne and a little bit of facial hair. And so that's just kind of something you have to check in with people. Hey, are you okay with this? This is the chance that it'll happen. Some of my patients are like, I'm plucking a few chin hairs anyway. What's a few more?
Yes.
Other folks are like, you know what? I had terrible acne when I was a kid. That was really psychologically tough on me. No, this isn't on the table. So you just kind of have to partner with people and see what their goals are.
I was using it for a while. My doctor had prescribed it for a while. I also have problems with chin hair, but way before I was on that, so it really didn't matter. I go to the electrolysis a couple of times a year, and that's good enough. So much great information, really. I just want to check to make sure. Do you have time to talk a little bit about gut health?
Sure. Where are we starting from? Like, tell me how we're going to narrow that. That's a pretty big topic.
Yeah. So, well, okay. So I could only go by myself. When I was going through perimenopause, I had a lot of belly bloat, a lot of gas. Sometimes I couldn't even leave the house. I was afraid what was going to happen. So I was going through a lot of that, but I was just eating a diet that I always ate. And all of a sudden, everything was different. I wasn't digesting the way I used to. And so when I did go to the functional medicine doctor, first of all, I was diagnosed with celiac. So gluten now was off the table. Dairy was also off the table, sugar, caffeine. And then I implemented a lot of supplements. Melatonin was a big one for me, and magnesium, another one. And I started to notice a difference as soon as I changed my diet.
Sure.
So
Yeah.
a woman who's in perimenopause, do they normally have gut issues?
Well, I think certainly as estrogen levels are changing, sometimes our gut will start to slow down. And you kind of want to think about your gut as like a stream that needs to keep moving, right? And so if you have stagnant water, you will have germs overgrow that maybe shouldn't be there. And then usually that turns into gas, bloating, heartburn, et cetera, et cetera.
Right.
And I think that we have unfortunately really normalized a very abnormal diet,
Yes.
right? So if we've normalized this very highly processed food supply, I think a lot of folks come in, and I hear this a lot, I just want to eat normally. And I'm thinking, well, what is a normal American diet is not biologically healthy for you. So, oftentimes hormonal placement therapy may get the gut going a little bit. I'm with you. I think many people would do well to say, okay, I'm going to take a month off and I'm going to do a whole 30, right? I'm going to eliminate grains, dairy, sugar, caffeine, alcohol, and I'm really going to eat protein, vegetables, nuts, seeds, healthy fats, and clean up for a month. And then it's kind of helpful to, okay, how well do I tolerate gluten? I'm going to eat a bagel and I'm going to just eat that in isolation. How do I feel afterwards? And a lot of times it's a light bulb for people where they'll go on the whole 30 and their rosacea will clear up and their gas will clear up and they'll have more energy and they'll start sleeping better and all these things will happen. And then they have a bagel and the next day their joints hurt, right? And so if someone is really willing to kind of dive in an elimination diet where you add things back in very carefully and methodically, you can really learn a lot about what's right for your body. I think that in midlife, we all need 25 to 35 grams of fiber a day. Most Americans are getting 8 to 12, right?
Yes.
Fiber is vegetables.
Yes.
And so lots of vegetables, nuts and seeds. Half your plate is non-starchy vegetables, a palm-sized amount of clean protein, the highest quality protein you can afford. So regenerative beef, pastured chicken, cage-free pastured eggs, etc.,
Yeah.
wild-caught fish, 2 fingerfuls of healthy fat, right? A quarter of an avocado, a little handful of nuts, a tablespoon or two of olive oil. That's your plate. And then if you're really working out and you need some carbs, you could do that with a really nutrient dense vegetable like butternut squash or sweet potato. If you tolerate grains, maybe quinoa or buckwheat sprouts, right? So everything on your plate is really giving you something versus a slice of white bread or white pasta. It's the nutritional equivalent of kind of wallpaper paste, right? You're not really getting anything
No.
from it. So I think, in the 90s, I don't know about you, like we were kind of taught to think about like what's not in our food, right? It's sugar free, it's
Fat
fat
free.
free, but it was full of chemicals, right? What was in our
Yes.
food? And I think we need to flip and say, what's on this plate? Do I have a lot of colors? What is the fiber? How much protein do I have? Do I have healthy fats? Where did my animal source come from? So I think a lot of people, if they just did that, they could really improve their gut health. I think there's some fantastic probiotics out there, and I think people get really excited about taking another thing. But if the probiotic needs fiber to live, it needs prebiotics
Yeah.
to thrive, right? Onions, garlics, leek, asparagus, all these wonderful resistant starches, right? So if you're taking a probiotic, but your diet isn't diverse and doesn't have enough fiber, those little guys aren't going to live and have babies in your gut, right? They're going to just die.
Right.
So I would really start with a diet and then, maybe do an elimination diet, try a Whole 30 and then add things back in. I think that's really accessible for a lot of people. And
Yes.
I think a lot of people would feel better. And then if you don't, then maybe it's time to do some functional gut testing and really dive in a little bit deeper where you're working one-on-one with a functional medicine doctor or other healthcare provider.
Right. That's great advice. Great advice. Any final thoughts you'd like to leave the audience with?
Take up some space for yourself. You deserve it. You've worked hard for a long time. When you get to retirement, you want to be able to enjoy it. The time to invest in yourself is right now, and you're worth it.
I love that. It's so true. It's so true. Dr. Watson, thank you so much for being here today. I truly appreciate it. I will put all of your information in the show notes so they could go to your website, your social media, wherever they can find you. And I would love to have you come back on again sometime.
Oh, this was great. And I have a podcast too. It's called Menopause Rescue. So we might have to swap it around. That would be fun.
Okay, it sounds great. I will also put the link for that in my show notes so they could go and listen to more of your episodes.
Thanks so much, Susan. Have
You're
a great day.
welcome. You too. Nice to meet you. Take good care.
Thanks.
Bye.
Bye bye.